While many are considering the pandemic to be winding down, for healthcare workers, there seems to be no end in sight. Dr. Jackie Honig, an anesthesiologist at George Washington University Hospital, thinks the mental health effects of the pandemic on healthcare workers can be long lasting.
It gets tiresome, and there's a sense of some burnout. So what I would do, what I did in the past when there were so many of these patients, is offer to say take a couple of patients and talk to their families, because that was a huge emotional burden. You're calling people, you're telling them their loved one is dying. No, you can't come see them. You could try to Zoom that, worked about half the time.
Justin Kim, a nurse practitioner who also works at George Washington University Hospital, has recently helped conduct a study that measured the stress levels of healthcare workers.
It's been a very stressful and difficult situation for anyone involved in the pandemic, with all of the sort of uh, spectrum of disease that we've seen, especially in the ICU and in the hospital over the past year and a half. It's been almost a year and a half. It's been quite difficult for us, but also has sort of brought us together as a team, kind of come together and treat these patients the best that we can. But yes, it's been quite stressful. From a overall data perspective, we were able to do a study which kind of surveyed all of the healthcare providers, or some of the healthcare providers who worked in the ICU and in the hospital, to measure their levels of stress at the beginning of the pandemic compared to a year later.
Could you go into a little bit more detail about how you conducted that study?
Some of our investigators, they created a confidential survey which sort of measured the risk perception of the healthcare providers, their feelings of risk of contracting COVID, giving COVID to their families, or potentially spreading it, as well as their level of stress and burnout, using a sort of validated scale, and also our own scale that we created as well. Um, and we went around with a link and gave it to all of the healthcare providers who worked in the hospital, whether in whatever role you were, whether it's doctors, PAs, NPs, nurses, respiratory therapists, all the nurses, and even some of the ancillary staff, to see what their levels of stress and risk were.
Here is Dr. Honig again with her final thoughts.
I feel, my life will never be the same seeing what I saw, but I can still work and take care of these patients. And again, I think it's because I have had over the year and several months less direct contact than the nurses did.
I would just, like to thank and appreciate every healthcare worker like out there who's been through the pandemic so far. Everyone who's worked or been a part of someone's life who's suffered through COVID is a hero in my eyes, and have given everything to be in this profession. It's not easy to go through something like this, especially if it's in such an unprecedented situation. um However, it's what we sign up for, and ultimately we're happy and privileged to take care of everyone who comes into our lives.